Welcome back. You're watching All Angles here on ENCA, and thank you so much for joining us. And on to this now. We almost all know of someone who has suffered from eczema at a young age. The effect of atopic eczema includes extreme pain and itchiness. The flare-ups don't really have a certain season. This happens throughout the year at much discomfort. And to discuss this more, we're joined by Pharmocologist, Dr. Dwayne Koot. Good afternoon to you, Dr. Koot, and thank you so much for joining us. Of course, there's various types of eczema, and these may even vary in terms of the aggressiveness thereof and the treatments. Just talk us through what atopic eczema is.
Good afternoon, Cindy, and thanks very much for having me. Good afternoon to your audiences. Yes, eczema is very much an umbrella term. Underneath that term eczema, you get atopic eczema, which is associated with an allergic etiology. It's brought about through type 2 inflammation. Although we might know of many people with eczema, it's not necessarily atopic eczema, which is predominantly a disease of infancy. And as mentioned, it is related to an allergic etiology. So it really goes with this atopic march, which would mean that many of these patients do progress then to have asthma and allergic rhinitis.
Yeah, so it's something that, as you're saying, it worsens with time if it's not treated, if I'm understanding you, and could also manifest in other chronic diseases and even lead to depression, anxiety, etc. Is that correct?
Yes, it does definitely start off in 90% of cases in infancy, and then some patients might outgrow it by the time they hit puberty, but what's not often discussed is that in adulthood, it could come back. So the disease is really characterized by flares. There might be triggers in the environment which brings about a flare, and there might be periods when the patients don't experience any of those flares at all. So it really can come and go. And as mentioned, it is associated with other allergic conditions. So as a child grows, the disease pattern might change. Where the skin lesions appear, that could change. In infants, it's very common for it to first appear on the cheeks. That's quite characteristic. And then as the child grows, those lesions might move to wherever the skin folds. So on the inside of the elbows, the back of the knees, also the hands and feet are quite common in adulthood. So although it is a disease of infancy, it can also occur out of the blue in adulthood. Something to mention, though, is that it is an hereditary condition. There's a huge genetic component to it, so it does certainly run in families.
All right, if it runs in the family, Dr. Koot, as you're saying that it also depends on the environment or what the flares are, what is the psychological impact of atopic eczema, especially in young people or adolescents?
Yeah, the psychosocial burden can really be quite debilitating. You can just imagine with it being a very visible condition, what that could mean to an adolescent in school, with peers not really appreciating what the condition is, unsightly skin lesions that can really change a person's life course. And it is a cumulative impact because you might just, you might retreat from society completely because you don't want to go out in public and show off your skin. This can, of course, lead to depression, anxiety, even suicidality in severe cases when the disease is not brought under control. So it's far more than just a skin disease. There's a huge burden which goes with it. We've mentioned now the mental aspects, the psychosocial aspects, but also because the skin barrier is broken, these patients often suffer from infections. In fact, repeat infections because the skin becomes colonized by staph bacteria. So there's a lot going on here. It's certainly, it goes way beyond just being a skin disease, and really just to mention that it is a chronic condition and it is systemic. So the inflammation which we're seeing on the skin, it's present actually throughout the body.
We seem to be losing you there, Dr. Koot. I hope just to quickly, before we let you go, where you can explain the advancement in the not early diagnosis, but in those that are suffering from atopic eczema and the treatment that is readily available, or is it more specialized? Is it something that you would have to, consult with a dermatologist, or can your family physician also be able to treat it?
I think the first port of call is definitely to consult with the general practitioner to try and bring the disease under control through therapeutic patient education. And in this condition, education can really be therapeutic by following the general skincare routines, avoiding the triggers, following the so-called bath rules, applying moisturizers liberally and frequently. Thereafter, stepping up to the cornerstone of pharmaceutical therapy, which is the topical application of corticosteroids. And if the disease is still not brought under control, then it's time to refer to a specialist, either a dermatologist or an allergologist, who can then potentially prescribe a systemic agent. As I mentioned, this is a systemic disease. So in severe cases that are not controlled with topicals, then it's time for a systemic medicine. There have been huge strides in our understanding of the type 2 inflammation, which really drives this disease. And our understanding of the immunological dysregulation is now at a point where we can target the drivers of disease very specifically. So it is an exciting time. And so my message will just be, don't accept a lower quality of life. Really strive for control of the disease. And if the disease is brought under control, then many of these psychosocial effects and the multidimensional burden can be alleviated so that the patients have a better quality of life.
All right, Dr. Koot, thank you so much for your time. That's Dr. Dwayne Koot, a pharmacologist, speaking about the psychological impact of atopic eczema.